Okay, so welcome everybody for a breakout session in the room 2. So at the moment we have 3 rooms. You can see in a chat channel links to 2 other rooms if you want to move to them at some point. And in this room we have 5 companies, and they represent so-called miscellaneous digital solutions during the COVID-19 crisis. The company set up in the room 3, they are all related to remote healthcare service provision somehow, so remote health services. So in this room we have an interesting setup because we were looking for companies who have different types of solutions. Let me see here why I don't see myself. Okay, so we will hear now short presentations from 5 companies, and presentations will take maximum 3 minutes. Some of them will be a little bit faster. After that, we will make questions for presenters. High-level questions, detailed questions, whatever you want to ask audience and other presenters. And questions I will be collecting from Q&A channel. So there are 2 channels in Zoom. One is Q&A and the other one is chat. So for the chat you can add comments and links and so on, but questions I will be collecting from Q&A channel. All that said, let's move to the first presentation by Mr. Matti from smartly.io. So I will stop sharing. So Matti, stage is yours.
Thank you very much, Riku. Let me see if I can just get my presentation live. I trust that you see my screen. So, yeah, as I mentioned, the COVID-19 has definitely changed the digital advertising landscape by quite a bit. Before I get to that, some things hasn't changed. For example, like who is Smartly and what we do. So just as a quick introduction, what we do is we help brands drive greater ad performance across multiple social advertising channels. Our customers, which include both companies and NGOs, use our platform to create ads in a more scalable manner, automate campaign creation and management, and draw insights from our reporting functionalities. So that hasn't changed, but as you may know, the COVID-19 pandemic has changed the landscape of social advertising. For example, many travel advertisers have drastically reduced, if not completely shut down their advertising for now. And here's just some examples of what we do or how we tackle this new reality that we live in. And one of the things is that we share regular insights of trends that we are able to observe. For example, on consumer behavior, that our research shows that most consumers, 9 out of 10, still want to see ads, or at least are okay being exposed to an ad from a company. They don't want to see companies exploiting the current situation, but rather address it head on and be empathetic in their messaging. We also share insights on demographics as to who are the demographics that are still engaging or shopping online, whether it's skewed towards male or female, old or young, if it's families versus single people, and so on. We also keep track on which categories are trending up and which are trending down, for not surprisingly, that people are spending more money on online groceries, electronics, and home fitness equipment. And well, one last remark I want to share that's beyond these insights is that Smartly has partnered up with Facebook and World Health Organization, and we are helping WHO to be more efficient in sharing correct information of COVID-19 and updates on it all across the world in countries that are affected by the virus. And I believe my time is up, and that was Smartly. Thanks for listening.
Thank you, Matti. Then we'll move to Origo and Guðjón, please, your turn.
Yes, hello. I'm trying to share my screen here. So, yeah, you see I trust you see my screen. Yeah, my name is Guðjón, and I'm the Director of Healthcare Solutions at Origo in Iceland. So, as I mentioned earlier, we are developing the national patient portal that is in use in Iceland and has been in use for the last 5 years. And we really see now and feel now that this epidemic has really shown that the importance of having a single national patient portal has really proven itself now. So just for all Icelandic citizens to have one place to go to contact their health providers, regardless of where you live, or even if they're public or private, has really simplified things quite a lot. We introduced a lot of new functionality during the pandemic, and some just developed over the weekend or overnight even, just to be able to ease the load of the healthcare workers. So just some of it is just basic things, but really make a lot of difference. For example, just yeah, here you can see the portal. For example, just for all test results to be transmitted automatically to patients that are tested negative, is quite does quite a lot to decrease the load on healthcare workers. So people are not worried or trying to contact their healthcare just to find out what the test results are. They get all the information they need through the portal. As been mentioned before, a secure telecommunication where people are already have a portal they can log into, but now they just have a new feature in it that they can have a video conference call with their care providers. And the key thing is, in this epidemic, we don't really have time to teach a lot of new things. So if you can make this as simple as possible, it's an added benefit, especially when you consider that the people that might need this service the most are not maybe tech savvy. One other thing we developed as well was for people that are in home quarantine because of orders from the authorities, they can actually register themselves. So we have an exact number of all Icelandic citizens in self-quarantine, and also they can get a certificate to provide to their employer, so they can actually get the benefits they have the right to get, and also sick notes, etc. That are now people previously had to show up at the primary care to get their sick notes. Now it's delivered electronically and signed. So just simple things that do a lot to decrease the burden on our healthcare system. The use of the portal.
Please give it a quick summary.
Yeah, so you can see on this graph just the how the usage has increased through the last few weeks. Thank you.
Thank you, John. Next, we'll move to Quizrr and Jens. Your turn, please.
Thank you very much. I'm going to share my screen with you as well. So my name is Jens Helmersson. I'm one of the founders of Quizrr, and I wanted to share a little bit about how we work with our solutions to support during the times of COVID challenges. Just first to give a quick brief explanation of what Quizrr is. We use business as a driving force to ensure that workers are trained properly. In many factories today, there's still managers who do not understand why this is such a hot topic and why this is so important. But when they start to realize that they can gain more business by just sharing that they are a responsible supplier, they start to train workers. Quizrr is built so that we do knowledge building on all levels. We use tablets or smartphones for training on different topics. It's always in local language. It's interactive films so that workers feel directly motivated by the films in their own language. We use a quiz game afterwards just to ensure that the knowledge is there so that we can measure the progress of the knowledge within the factory. And we use our portal to just send data back both to the factories, but also to the brands in real time so that they can see that these factories take the responsibility needed. Workers are surprised and happy. This is often the faces that we see when they start training, when they realize that these almost like soap opera films are built for their lives and for their trainings. Factories are surprised because they see that these are solutions that are easily engaged and you can move them around within the factory. And brands are happy because they see that the topics that they need to cover is covered. We also see great cases today where suppliers are seeing big increase in production, just keeping the good staff within the factory and ensuring that they stay. For the COVID, we have given away some occupational health and safety in China, both on the basic and advanced level, and also in Bangladesh and in Thailand. This is just to help workers to train, even though they might not be in factories, they might be in quarantine, but they can continue to train on their own health and safety topics and ensure that they can learn more about their rights also when they're not in the factories. We also give discounted offers just to make sure that companies are easily coming on board. And that is easier also for brands not having to pay for the annual fee right now, just making sure that we can continue to scale and get more people on board and ensure that they are trained. So if you want to know more, please contact me. I'm Jens Helmersson at Quizrr.se or info@Quizrr.se.
Thank you, Jens. Okay, then we'll move to Aranja and Eiríkur. Please, your turn.
Can you unshare your screen? Yes.
Yeah, try to do that, but let me just see. All right, there you go.
Great. Let me just bring this up here. So, thank you, Riku. My name is Eiríkur Nilsson, and I'm the CTO of Aranja, which is a software agency in Iceland. So we were part of the private initiative that launched the COVID tracing app in Iceland. Of course, everyone is building tracing apps these days, so why should you care about this one? Well, I think our story is pretty interesting. Like everyone, we've been in a race against time, responding to this pandemic. And in early March, our active cases was growing exponentially. So a bunch of software companies joined together and kicked off a project to help with our tracing efforts. And in just 13 days, we had built and even released one of the first COVID tracing apps in Europe. And only a few days later, active cases started falling significantly. So of course, we took all of the credit. I'm kidding, of course. But how does our app work? We start by authenticating the user. However, we only ask for the user's phone number. Then we request permission to track the user's geolocation. This information is only stored on the device, and that's it for most people. But when someone gets diagnosed with COVID, the tracing team contacts the person and asks if they want to submit their geolocation data to help with the tracing. You might wonder why we took this route. We did look into Bluetooth tracing like other countries, but felt that it was not reliable enough yet on iOS. But Trace Together actually inspired us to store data locally instead of in the cloud. And we were in a race against time, so we decided to start with a simpler solution with less security and privacy risks. A simple design also helped with adoption, but we reached around 50% of our target audience. It also complements our existing tracing efforts really well. From the beginning, we've traced every single infection manually. And thanks to this effort, over 50% of all new infections were already in quarantine. The tracing team has expanded considerably, but often they deal with sloppy memory. So this app provides an excellent tool to assist with the manual tracing, helping refresh the patient's memory of where they've been and who they've met. This app is also open source. And we did this to provide total transparency in what the app does and how it works, to facilitate software cooperation between nations, and to open up development to contributions. Finally, we are planning to integrate Apple and Google's Bluetooth tracing protocol into the app for automatic contact tracing. This checks all of our boxes: privacy conscious, well-implemented cryptography, and less iOS issues. Tack.
Thank you. So then, looks like we have one person left, and that is Digital Talk Company and Virpal. Your turn, please.
Can everyone hear me?
All good. We see and we hear.
All right, perfect. I'm representing Digital Talk, which is providing digital solutions for interpretation. I'll start talking a little bit about the problems that we've seen in the market. It's that it takes too long to get an interpreters. The quality of interpreters that public sector has been getting has been of low quality, and it's been very difficult to get hold of one at all because of the perceived lack of interpreters. We've seen huge problems in the market with poor interpreter skills, and this is reported weekly in newspapers as well. We took a different approach and believe that there's no shortage of qualified people, but it's that the industry has been very poor in coordinating it. So our approach was that with a tap of a button, you should be able to get an interpreter, which means that nurses can put more time with patients rather than administration, calling around and doing unnecessary admin activities. Our solution is that our customers can book an interpreter through our website or our app. And as a response to COVID-19, although we were already providing video solutions, interpreters doing interpretations and translations from home, we've now introduced three-party interpretations, which means that the customer here in our use case now is a clinician who is in the clinic, a patient who is at home, and an interpreter who is at home, where the clinical staff can automatically send an SMS while booking an interpreter in the user's language. So they'll get a link with instructions in, for example, Arabic or Somali, because that's been a huge demographic shift here as well, where certain demographies are overrepresented in COVID statistics. So what we've done is that we send the information in Somali. You need to join their video room by doing this, that, the other. And upon that, the clinical staff can communicate with the patient. And that means that not only does this empower patients who are non-Swedish speaking or local language speaking to get access to healthcare, but also to empower them to get access to information, because that's been a huge difficulty in that market. We've seen a tremendous growth in general in our market, as it has been. And we're seeing that we have the scalability to grow with this crisis, so we are not too worried about the numbers growing as well. Selection of our current customer base is hospitals, law enforcement, government agencies, and public administration. And we are also now working on strengthening our AI offering, which is improving the quality of automated translations that current IT providers are providing. So this means that we are enabling the clinical environment to get more accurate and GDPR compliant translations. If you guys have any more, and I know that this is a challenge not just in Sweden with certain demographies overrepresented. This is something we're seeing in Singapore as well, where foreign workers are overrepresented in the statistics, where we see that we can make an impact in a relatively easy manner. For more information, feel free to get in touch with me. I will be available in the coming few days, and we are expediting our work in this area. Thank you very much.
Virpal, thank you. So we told beforehand that this whole event will finish at this time, but this breakout room started 10 minutes late, or actually even more. So we will continue. But for those who have to log off because you have other pressing issues in your calendar or on your plate, it was great to have you here. My name is Riku Mäkelä. I'm the chairman of the board of the Nordic Innovation House Singapore. And my full-time job is at the Embassy of Finland in Singapore. So at this point, thank you for everybody. But now we will continue with questions and answers with everybody, with those who will stay. So about 10 minutes at least, we will continue. So we have here kind of a question that goes to the point from Elba, from UNDP Global Center in Singapore. So it seems that the next huge wave of COVID-19 crisis will hit really badly the developing countries, emerging nations. So how well can you help those countries? What is the potential for your solution in developing countries? And how fast could you help to implement your solution in these types of nations? So let's go in a row. In the same order as we started. So Matti, if you could start from Smartly's point of view.
Yeah, well, the impact can be questionable, but the implementation time is obviously very quick because we are a SaaS service, platform that can be accessed by anyone who has a computer and internet access, and I guess for our collaboration with World Health Organization, it's anyone with access to Facebook, Pinterest, or Snapchat. We can target those countries and those audiences with the correct information of the pandemic and updates, and for example, use cases of masks and benefits of social distancing and so on. So we basically deal with information. It's really easy to get to everywhere that has internet, but then the real life implication of sharing that information is, who knows?
Okay, so you can help anybody who has needs for communications in Facebook and soon in other platforms. Thank you. So then, John, what about Origo?
Yes, the solution we are promoting is a national patient portal system. So that's not the kind of solution you can launch overnight. So our message is basically this: the reason we were able to ease so much of the load of our healthcare workers was we already had this in place. So I have two messages really. First is we have to start planning for the next pandemic. And the second one is the strategy of having a national patient portal system as opposed to having a separate system for different healthcare facility is a really a good strategic decision to make early. So this decreases the complexity to the end user who does not have to know who is going to serve me now or who's going to provide care for me now. You have a single point of access. So we are not outsourcing the complexity to the user. We're actually solving the complexity for them. So yeah, that's really my take on this.
Okay, thank you. And we heard from, for example, from Singapore speaker in the first session, how Singapore has kind of streamlined different things so that there's one source of information for certain type of things and so on. Okay, so then what about Quizrr? So Jens, what is your potential in developing countries and how fast could you implement?
Yeah, I think as long as you want to reach workers within factories, for example, with the rights information, as long as there is films already in the developing markets, or if there is more information that you want to reach them with, for example, how to stay healthy during COVID times, as long as there is video already created in local languages, we can easily put it into our system. But it's a little bit more targeted towards than the factories, but it helps to create measurability. It helps to ensure that you get transparent sharing of the data, and you can know who is trained.
Thank you. So then, Aranja and Eiríkur, so you developed tracing applications. So what about you? How could you help in developing countries, and how fast?
So on one hand, our solution and many tracing app solutions are open source and can be semi-easily integrated and launched in new regions. But for developing nations, especially, their challenges are like someone has mentioned, that 2 billion phones will not be able to participate in tracing using Bluetooth geolocation, and more so in developing nations, because those phones are not smart devices, iOS, Android. They do not have Bluetooth GPS systems, and so that will be the challenge there. Of course, our application is meant to supplement things that you can do, which is the recommended approach of testing, tracing, and quarantining, and you should probably focus on that.
Thank you. So now we will have the last answer for this question, and now it's time for anyone who is interested in shooting questions in. I will only take questions in for the next couple of minutes, then we'll see if we are closing the event. So now, Virpal and Digital Talk, please.
Our solution is definitely applicable in developing countries, as there's a communication issue there as well. This issue will be global, not just in developed countries. So this is highly relevant in developing countries as well. And we're able to deploy within days to a new market, so that we are able to assist in these new areas where these waves are arising. So highly relevant, very highly relevant.
Okay, so then all of you company representatives are from the Nordics. Do you have anything to ask from each other? Because you're actually representing pretty good set of different countries. Any questions to each other? Anyone? Okay, so it looks like we can finish on the time I promised. So recordings of these sessions, all the sessions of today, plus a lot of additional materials from all of the presenters, plus additional information from all of the presenting countries will be shared tomorrow by the end of the day. And then we hope to see you online in other events in the future. We plan to organize them, and others are organizing them. So let's now connect afterwards, all those who are developing something or are providing something or are needing something, because this is now time about sharing and quick implementations moving forward fast, so that we can shorten the length of the crisis with digital and other tools. So thank you, everybody, and stay safe, stay healthy. Thank you, bye-bye.